The truth about fatty liver disease. What if one of the most dangerous diseases could be silently growing inside your body without causing any pain? No fever, no warning, no obvious symptoms. Yet millions of people are living with it every single day. This hidden condition is called fatty liver disease, and if ignored, it can lead to liver failure, cirrhosis, or even liver cancer. Dive with me as we are uncovering the truth about fatty liver disease, what causes it, how to recognize it, and most importantly, how to protect yourself before it's too late. Your liver is one of the hardest working organs in your body. It filters toxins, stores nutrients, regulates blood sugar, and helps digest fats. But when too much fat builds up inside liver cells, the liver begins to struggle. Doctors generally diagnose fatty liver disease when excess fat accumulates in the liver. In many people, this happens without noticeable symptoms. Over time, this fat can trigger inflammation and scarring, reducing the liver's ability to function. So what causes fatty liver disease? One form is linked to heavy alcohol use. Another, now more commonly called metabolic dysfunction-associated steatotic liver disease, MASLD, is associated with conditions such as obesity, type 2 diabetes, insulin resistance, high cholesterol, and diets high in added sugars and ultra-processed foods. Lack of physical activity and excess abdominal fat can also increase the risk. Even people who aren't overweight can develop fatty liver disease if they have metabolic risk factors. Here's what makes this disease so dangerous. Most people feel perfectly fine. Some may experience fatigue, discomfort in the upper right abdomen, or unexplained weakness, but many have no symptoms at all. In many cases, fatty liver disease is discovered only during routine blood tests or imaging scans performed for another reason. If the condition continues unchecked, it can progress. The liver may become inflamed, leading to a more serious stage of disease. Over time, repeated injury can cause scar tissue to build up, a process known as fibrosis. Advanced scarring is called cirrhosis, which can permanently damage the liver and increase the risk of liver failure and liver cancer. The good news? Progression is not inevitable, especially when the condition is identified early and managed. How do doctors detect fatty liver disease? Diagnosis often begins with blood tests that suggest liver inflammation. Imaging tests, such as an ultrasound, can show fat in the liver. In some cases, additional scans or specialized tests help estimate liver scarring. Your healthcare provider decides which tests are appropriate based on your symptoms, medical history, and risk factors. The most encouraging part of this story: fatty liver disease can often improve. Lifestyle changes are the foundation of treatment for many people. Losing excess weight gradually, eating a balanced diet rich in vegetables, fruits, whole grains, lean protein, and healthy fats, reducing sugary drinks, and exercising regularly can significantly reduce liver fat. If you have diabetes, high cholesterol, or high blood pressure, working with your healthcare provider to manage those conditions is also important. For people whose disease is related to alcohol, stopping alcohol use is a critical step. Protecting your liver doesn't require perfection. Small, consistent choices every day can make a meaningful difference. Choose nutritious meals. Stay active. Maintain a healthy weight. Get regular medical checkups, especially if you have risk factors like obesity or diabetes. The earlier fatty liver disease is found, the better the chances of preventing serious complications. Your liver works around the clock to keep you alive. The question is, are you taking care of it? If you found this documentary helpful, share it with someone you care about. You could help them discover a silent disease before it becomes a life-threatening one. Thanks for watching. Stay informed, stay healthy, and we'll see you in the next documentary.